Thank you, David, for the introduction and for your presentation. It was great. And as David so ably demonstrated about the global burden of oral disease and what can we do about it, I'm now going to focus quite specifically on one of those things, as you mentioned, which is volunteering. And my part of the presentation today is really, as it says, personal and professional considerations, deciding if it's right for you, but also I'm going to talk not just about the motivation, but also some of the metrics which really can measure whether what we do as volunteers is effective and worthwhile in doing so. So as an outline of what I'm going to talk about today, it's really in two parts. A shorter first part, the motivation part, a volunteer's journey, my particular journey, as to why I became a volunteer, how I went about it and where I went. And then after that, I'm going to talk about the principles in practice. In other words, how do you have a volunteer project work in an effective way that can be measured and shown to be something that is worthwhile doing? So first of all, why, how and where? Well, today is more about how than why, and the why must be answered, but only the individual can answer that why question. It's one of those personal motivating things that I guess if I can just explicate a little bit about what drove me, then that can be at least an answer when people ask you, why should I volunteer? So my journey really began, as David said, 20 years ago, and basically I formed a group with another friend, which we named Equal Health Australian Overseas Aid Fund. And initially, all those years ago, we went to India. So I'm back in the place where it all began. And my motivation back then, if someone had said, well, why are you going to volunteer? I'd have some unformed, not quite clear answer about giving back to humanity, sort of helping give back to help answer for all of the gifts that I have living in Australia. And so that's where it began for me in terms of motivation. And I think most people would find it hard to articulate initially why they start. But over the years, I've thought about it a lot and thought about, why would someone volunteer? And not just about why, but how. So from India, which we still send a team, in fact, I'll just go back. We started in India in 1999 as an official group, and we've been coming here every year since, mainly to the state of Tamil Nadu, sending 60 people who are dental, medical, optical and allied health to treat some of the poorer groups, and that carries on to this day. But we've also been to other countries, as David mentioned, to Bali in Indonesia, to Zimbabwe, South Africa and Thailand. Currently my main role is to work in Timor-Leste, or East Timor. And there we work with a partner, a local partner, a coffee growing cooperative named Cooperativa Café Timor. They have a health branch, the Clinic Café Timor, who are actually the largest provider of healthcare in rural Timor-Leste. Basically, they work in the mountains of Timor-Leste where they grow the coffee and treat the population there completely for free. And our model is to send volunteers to work alongside that local health group and by sharing the care of their patients, helping to develop clinical skills that they would otherwise not necessarily prioritise. So that's enough about me and about a volunteer's journey. What I'd like to now talk about is an individual project and relate back to that project some of the things that you could measure and ask, why is this project working or why is it not working? What are the considerations that need to be done? So I'm going to talk more about that in a specific case. Other speakers today will also talk about other aspects of that in a theoretical and also in a specific way as well. A lot of my principles are based upon the Handbook of Dental Volunteer Projects, which is written by Dr. Jamie Robertson, an Australian. There's a link at the bottom of that slide, and if you would like to get that link, I'll have my email address at the end of my presentation. And we're also going to have this on YouTube, I believe, in a couple of weeks' time, and you'll be able to see it there as well. Okay. So the Kimberley Dental team is where I'm going to speak from. It's a project based in Australia. It's not overseas for me, it's local. Australia's a big country, and the Kimberley, which you can see in that little map, the little green square, that, while Australia's a big country, this is also a big part of it. It's basically as big as Venice, or 3 times the size of England. I've got the statistics here. Sorry about that. the most northerly district of my home state of Western Australia, and it's, as I said, an enormous area. Aboriginal people settled there over 40,000 years ago and have continuously inhabited that space ever since. At the moment, in that whole area, there's only 40,000 people, of which over 17,000 are Aboriginal. And that cohort of the population is a young cohort. 73% are under 45 years and 50% are under 20 years old. And they're not an affluent group. Socioeconomic index for the areas of the Kimberley region, excluding the city of Broome, show that this area is the lowest 10 percentile in terms of that socioeconomic index. And there's lots of reasons for that. The social and health issues are rife. There's alcohol and drug use. Fetal alcohol spectrum disorder is 16 times the state average. The area has mental health, suicide, self-harm, obesity, malnutrition, diabetes, ischemic heart disease, domestic violence and abuse, and transport accidents. And so they're really a population that needs help. So the reason for all of those things, besides the young age cohort, the low population density with large distances in between the various communities, and the cultural issues with Western medical model of fixed appointment led the Kimberley Dental Team to first be formed. So the founders of the Kimberley Dental Team were John and Jan Owen. John is a dentist, and Jan, his wife, decided that they wanted to do something about the poor oral health of the Kimberley region. And so when they considered what to do back in 2009, they went back to first principles, and they took time to plan some more. And they took in regard to those important principles that every project needs to follow, having a respect for the local population, understanding and listening to their needs. They talked to the authorities about getting permission to have legal ability to deliver the care in the best possible way. They talked about capacity building versus just the band-aid approach. Now, there's many project types that can exist in volunteerism, from teaching hospitals to working under a tree. In terms of KDT, which is Kimberley Dental Team, they did those things. They listened to the local partners, the local Aboriginal communities. They got approval to work within the facilities such as there were. They thought about how their project could be supported and sustainable. And really, their ultimate aim, as the aim of most projects, should be to become redundant, to help the local community work out local sustainable measures to deliver healthcare. One of the principles that I think we should follow with healthcare wherever we go is above all else do no harm. And so within that, Professor Prateep will certainly speak about the WHO basic package of oral care, which involves such things as the ART, atraumatic restorative treatment. Sorry, I've gone too far. And other models of treatment. So I won't go into that too much, the appropriate treatment, and also the scope of treatment. In other words, what's an appropriate thing to offer to help the oral care in these regions which are so remote. So KDT version of their clinics and equipment were to keep it simple, to have things that are certainly at the best level they can be in terms of infection control, but to be flexible as well within the treatment delivery. Things like standardisation of equipment to make for easier maintenance, keeping it reliable, robust, non-computerised. These type of things are very important in terms of any project, and certainly KDT focused upon those things. With volunteering generally, and certainly with the KDT model, there's cost to volunteering, and really that cost isn't just about dollars. That does come into it, but there's also such things as travel and living conditions. And certainly in the time that I've been working with the Kimberley Dental Team for the last 5 years, I've slept in a sleeping bag under the stars among cow dung to living in a motel. It varies a lot depending upon the individual project. There are other costs. There's time away from home, which means time away from family, from work. And when someone wants to volunteer, they really do have to think about those things. Cooperation within the team is an extremely important thing depending upon how many are there. There's a lot of emotional and mental stress points for people when they come out of their comfort zone to a place where they don't normally work. And cooperating with each other really does help those sort of stresses become manageable. And certainly with the Kimberley Dental team, that's a very large part of their debriefing in the evening every time after the day's work. So basically, a lot of what KDT have done is really to listen and learn and try to target their efforts to a preventive nature. They produce booklets such as the one you see on screen, Strong Team, Teeth, Strong Body, Strong Mind. And then they go to the local community such as that one, Frog Hollow, where they pass on as much as possible the preventive message, not just about treatment and certainly not just about extractions. As I've written here, their emphasis remains strongly focused on the prevention. In fact, nowadays, caries and periodontal strategies comprise 70% of all services provided. Increasingly, restorative care is over 8% now, whereas surgical care, such as extractions, is now only 3%. When they first began their project back in 2009, it was almost all extractions. So they've really developed over over these years. I just got an email today from Jan, the founder, and I was talking about the toothbrush program that you see here, and there's another slide about it. And so, as she said only half an hour ago, the fact is that they provide 20,000 toothbrushes and supplies per year, and they're being distributed to schools, early learning centres, playgroups, and community clinics. All 43 schools in the region participate in the program, although not all children. Often we find the older children in the bigger schools, such as Horse Creek and Fitzroy, don't participate, whereas children in the smaller schools are usually involved. And that quite often comes down to the teachers within those schools. And don't bother trying to read that blue form there. But one of the ways of measuring success is to do a questionnaire to the teachers about how effective the toothbrushing program is. And really, the metrics of measuring success, again, from a Kimberley Dental team perspective, really comes down to recording those types of treatments provided. If you can measure it, you can prove it. And if you can prove it, you can show people why it's worth doing. Within the delivery of care, there's often inertia within communities to change, and it's important for volunteers to have patience and perseverance so that things don't change overnight. You don't want to spoon feed and just provide band-aid care. You really want to add capacity. But at the same time, if after some trips and you're measuring your metrics and you're finding things aren't changing, then you need to stop and rethink about how you're delivering care. Think about how it can be improved. And so with regard to the Kimberley Dental team, I think the biggest metric has been that move from extraction to restorative care, always with the strong preventive focus that has been from the very beginning. So finally, I just leave you perhaps with a few points as to why I'd like you to contemplate, if you like, in terms of my message today. Number one would be to work in harmony with any existing dental health policies. Certainly bring appropriate resources to get the job done. Equipment maintenance is vital to sustainable projects. Volunteers should not do what locals can do for themselves. Complement what already exists. Aim for self-sufficiency. Wait and watch before judging an existing project or health policy. But as I said, if after 4 or 5 visits nothing changes, then rethink your project. And again, existing practices have the inertia to change, have inertia in change, and so you just need to be patient. So with that, I'd like to thank you very much for listening to me.